I've been worrying up all night, particularly after listening to what's going on across the country and the globe, and especially in the great state of New York. After hearing Andrew Cuomo and his brother Chris talking about this problem and the level that this has gone to, and the severe shortage of respirators and other appropriate personal protective equipment, I woke up in the morning and I came up with an idea. I haven't been able to let go of this idea. And it is something alternative to these masks that on one hand is supposed to prevent the transmission of the virus at 95%, but as we know, their effectiveness alone is about 11%. From that, I got hold of a dive mask. Something that covers the eyes, the nose, and the face 100%, seals on the face, and can be adapted in order to have filtration to the top to prevent the transmission of that COVID virus. At first, I used the material of the 95 mask, cut and shaped and glued with a glue gun, and a few other things from the office. I'm a podiatrist, and we get pretty creative in this field. I've been doing this for over 40 years, and my father grew up in a hardware store in the middle of Hell's Kitchen. That's led to a lot of creativity, particularly along the waterfront in Staten Island, New York, with wooden boats. So here we are with COVID-95 mask material, and fashioned it. It works. I've tested myself with a pulse oximeter while it's on, so moving around, I can still stay active and have an appropriate level of oxygenation. At the same time, these masks are in shortage. People are wearing bandanas on their face, and women are sewing masks out of things that only work 80%. But when you think about it, this mask was created for dust and particulate matter. Yes, it theoretically blocks the virus at 95%. Why don't we block it at 105%? From that, I did some research and came up with activated charcoal. Activated charcoal has been used for centuries related to health issues in our water filtration systems. I then did what I'm suggesting we all need to do. If you get an idea, don't let go of it, and don't work alone. So I reached out to a neighbor who's an economist with NOAA. I reached out to a mining engineer. And Jack Amira said to me that activated charcoal will filter out carbon monoxide and carbon dioxide. He said, your COVID virus, it's not so small. To me, it's pretty tiny. He said, but you can see it on a microscope. You can't see carbon monoxide and carbon dioxide. Activated charcoal will filter out down to 0.03 microns, approximately 30 times more filtration than's needed than to keep us from getting the COVID virus. With a little bit of a mesh bag, readily available, stitched or glued together, fashioned to fit the inside of the chamber, in minutes, this can be fashioned, filled with activated charcoal, and then covered, in this case with a HEPA filter, to prevent breathing the carbon. This fit easily inside this chamber, and this would fit in the chamber of any dive mask. The mask is then placed over the forehead, sealing. This is now sealing the eyes, the nose, and the mouth. If there's any air leak, when it's checked, before you put your filter on, a little bit of Vaseline will take care of that. Once that's checked and the seal is complete, the cap is placed back over this, which is easily done. This is easily done by the person wearing the mask. No one else has to handle this. And your hands are on the outside of this mask. You now have complete breathability, no fogging inside the mask, and complete seal. I believe that with this mask and a filtration system like this, we can keep our healthcare workers safe, comfortable, and able to carry on with more confidence that they'll be protected as they help to treat us and take care of us during this terrible crisis. So, feed your brain at night with positive ideas. Feed your brain with hope. Feed your brain with things that you might be able to come up with. And in the morning when you wake up, act on those thoughts. Reach out to others. Come up with some way to help during this terrible crisis. Share it with people. Do anything you can to help. Nothing here is proprietary. This was not created to sell. This was created to do and to get it out there. Yes, it may need some more testing. And yes, I could use some more help with this idea. If you think you can help to get this to the level where we all know that it's safe to use, contact me immediately. Let's get this going. And any other ideas you have. Let's help all those people in New York and all over our country.